73633, 73633.
One of the biggest problems for the causation of back injuries in nursing, both in acute care and home health care and long-term care, is that none of the facilities that I've studied and I've researched over my 15 years as being a safety director in this field have ergonomic policies, nor do the facilities have standard operating procedures on how to lift patients. Therefore, since there are no procedural requirements, anybody can lift anybody. Most of the NIOSH studies now show that the average lift exceeds the NIOSH guidelines by orders of magnitude for each particular and specific lift.
The concept of team lifting emerged from research into back injury rates among nursing staff in the United States. This research, conducted by Bill Charney and his colleagues, found that there are epidemic levels of back injuries among nursing personnel in all sectors: acute care, long-term care, and home health. The research team looked at the problem with the idea of finding a solution. The review of the literature produced over the last 25 years showed that none of the interventions tried had any appreciable impact on injury rates. With this information, the research team developed the ideas and methodologies of team lifting.
The two most important elements of this methodology were, one, that lifting is a skill, not a random task, and secondly, that you have to put risk where it can be controlled. That's the basic ABCs of risk management. And you cannot control all the variables of risk in a whole nursing department. It's impossible. So the concept of team lifting was we would develop professional lifters, and their only responsibility would be to do the total body transfers in every facility. That's the concept of team lifting.
In the past, almost every medical facility and convalescent home in the country has tried to reduce back injuries by training their staffs in proper lifting techniques. Researchers who have tracked the results of this training have found that there is a negligible dose response. That is, teaching hospital staff proper lifting techniques does not impact injury rates in any meaningful way. Even though implementing a team lifting program may seem like a radical step at first, it has proven to be the single most effective solution to the problem of back injuries. Administrators need to feel comfortable with the concept of team lifting. They need to be convinced that the team can fulfill all of the lifting responsibilities that exist in their facilities.
Methodologies of lifting in healthcare facilities are one that the majority of patients are non-ambulatory. This is not the case. In our studies, only between 10 to 15% of the patients needed to be lifted per day. That number can increase in chronic care and long-term facilities. However, there are ways of dealing with that differential. Secondly, another major methodology is that nurses can be trained to lift safely. That's a methodology that's not proving true in peer-reviewed literature. Thirdly, that a lift can be done safely if it's non-mechanized. What the literature shows and what the studies show and what the biomechanical studies show is that the average lift will exceed the NIOSH guidelines by orders of magnitude for each person doing the lift.
Hi, Mr. Solis.
Hi.
My name is Ricardo.
Hi, nice to meet you.
Marwan.
Hi.
And we're here to help you get out of bed.
Okay.
I understand that you cannot put any weight on your legs. And we brought a wheelchair and a mechanical lift to do that.
Okay.
Okay? This is the mechanical lift, and this is the sling. This
Okay.
part goes under you, and we hook this part to that. It's very safe. It holds up to 400 pounds.
Team lifters must have the ability to communicate, both with patients and nursing staff. Putting patients at ease and eliciting their help makes lifts far easier and safer.
The bottom part of the sling goes right under your knees, sir. It's very important. You can lay back now.
The team must be able to follow the ergonomic policies at their facility. And those policies should include as their #1 priority that every total body transfer be done using mechanical lifting aids. Using these tools is the key to making team lifting work.
Okay.
Manual lifting is the cause of the high epidemic injury rates that we have in this country. Therefore, for every total body transfer, and we define that as patient from bed to chair, from bed to gurney, from chair to bed, from chair to wheelchair, any total body transfer of a non-ambulatory patient has to be done mechanically. The lifts have to be mechanized.
How to contact a lifting team when they are needed is a fundamental question when considering setting up a team lifting program. The communication systems that are set up to contact the lifting team are dependent on each facility's technology. For example, some facilities use overhead paging systems, while other hospitals have been using telephone beeper systems and other paging systems with excellent results.
We've been finding through our studies that an on-call system to communicate with the lifting team is the simplest method of communication. An on-call system can be done with the technology that any facility already possesses, whether it be a beeper system, a radio system, or even a telephone system. Most of the hospitals in our 10-hospital national study are on a complete on-call system. You can design a response system that has a scheduled structure within it. For example, the team can start in the morning and go from the top floor to your bottom floor where your wards are and make rounds.
In between the rounds, the lifting team can be on call, or they can be on a completely scheduled system. For example, at the end of each day, the nursing staff can make up a list of patients that need to be lifted that the team would pick up in the morning. Emergency lifts can be given a special code, transmitted either through a paging system or an overhead system, so that the team can respond immediately in the event of an emergency. An emergency lift can be defined as a patient being on the floor. For example, a patient is being walked by 2 nurses, and he falls. The general policy in an emergency is that the nurses make the patient comfortable on the floor while they page the lifting team. The team then lifts a patient using a mechanical lifting device. Once the program is in place, lifting team members need to maintain their physical conditioning. Lifters don't have to be bodybuilders, weightlifters, or huge males. What they need to be is in good physical condition and be well versed in proper lifting techniques. It is very important that they exercise before coming on to each shift. A body that is warmed up is a body that will have much less chance of injury, and if an injury should occur, the severity will be reduced if the body is warmed up properly.
The startup costs for implementation of a lifting team include salaries for the 2 team members per shift. We recommend that each hospital start implementing a team on the day shift, which traditionally has the highest rates of injuries. Secondly, the startup costs include equipment costs. If your hospital has mechanical lifting equipment already budgeted and already within the facility, those startup costs, again, become less.
Quick access to mechanical lifting devices like a Hoyer or other hydraulic lifting device is essential to team lifting success. And each medical ward should be supplied with at least 1 slide board. The cost of purchasing this equipment, if you do not already have it, should figure into your startup cost for a lifting team. Team training costs include a 3-day course for team members in body and biomechanics, body physical therapy, and pre-visualization techniques. Also needed is training in using mechanical lifting devices and managing forms and the administrative responsibilities for the team. These costs usually run approximately $200 per day per lifting team member. In facilities that can afford to hire only 2 full-time employees for the lifting team, the best way to administer sick leave and vacation time would be to have one professional lifter work with the nursing staff. The professional lifter organizes and directs the lift, while the nursing staff member is there for support. In hospitals studied that use this method, no injuries were reported.
In the 10-hospital study that we've just sent in for publication and peer review in the American Journal of Occupational Health Nursing, the results are as follows. 1, we found a 90% decrease in lost days. 2, we found a 60 to 90% decrease in compensation and medical costs for the hospitals that were able to retrieve that data and report that data. Thirdly, we found a dramatic decrease between 60 and 90% in severity rates.
The researchers designed a 10-hospital national study, which included 1 nursing home, in order to get statistically usable data on the effectiveness of team lifting. The main criterion for being in the study was that the hospitals had to have a high enough back injury rate to be able to retrieve statistically significant information. Each hospital implemented a lifting team, and data was taken of their injury rates, their medical expenses due to back injuries, and their compensation costs 1 year before they started the program. That data was compared with all the data 1 year later.
The quality assurance surveys that we performed during the study showed, 1, through questionnaires of nurses who were participating in the study, that the nurses had a 100% total satisfaction with the team, that the team responded adequately to each call, they responded in a timely fashion, and in some of the studies we were able to report out that the response time was between 3 to 5 minutes and the lift time was between 3 to 5 minutes. The nurses loved the team because it removes one of their largest compensable injuries, that they began to rely on the team more and more as the study progressed, and we learned that through questionnaires. And through patient satisfaction questionnaires, we found that there was a very high percentage, between 90 to 95% satisfaction on a patient questionnaire survey.
The key to making team lifting work for your facility lies in reducing the population at risk to back injuries. Team lifting is a solution that works. It is up to you to make a change that will effectively reduce your facility's injury and compensation costs. For more information, contact your State Fund Loss Control representative.